welcome back from the break. We are so pleased to get a recap of some of the panels that we had here at the World Healthcare Congress. We're coming to you live from Washington, D.C. This is WHCC TV. Thanks for joining us. We now have Katie Kirkland in our studio. She is Director of Benefits at Southern Company, and she sat on a panel today. Thank you so much for your time.
Thank you.
So what was the topic of the panel that you were participating in?
We talked about mental health care and kind of reimagining our strategy around providing mental health care for our employees.
Okay. And are you seeing from data that mental illness is on the rise? Is it the numbers kind of consistent or on the decline?
Well, the data is tricky to really wrap your hands around because not a lot of people report on mental health. It's something where we want to see increases in utilization. We want to see them getting increases in care. I know that we have data from our engagement studies that show that stress is very high and people are more and more concerned and more vocal about it. And so we really wanted our strategy to connect back to that and try to solve some of those issues.
Okay. Any indication on where the stress is coming from?
People have stress from all kinds of different environments. I mean, we're an energy company, and so, that in its nature can be stressful, knowing that you're needing to keep the lights on for everybody in the territories that you service. But people have family stress for their children, stress for different conditions that they're dealing with. So it's really pretty widespread.
Mm-hmm. Are there any special programs happening at Southern Company to address that?
We have just rolled out a kind of a revamp of our strategy, so we've thought about it a little bit differently. Mental health is typically included with your medical care, and we realized that wasn't serving the needs of our employees nearly as much as we would have liked it to. And so we separated our approach to mental health outside and really looked at it differently from medical and created a whole own strategic vision around it.
Okay, and what does it involve?
Well, we realized that we had issues with access. People weren't aware that we had programs to help them with their mental health. They didn't know what those programs were. When they did realize that they have programs, they reached out and they didn't have providers that were covered in our network. And with that, there's even stigma associated with, seeking mental health care. And so we tried to combat all three of those things by removing the barriers to that access, removing some of the cost constraints, and then also trying to destigmatize that program.
Mm-hmm, mm-hmm.
I would say probably one of the most impactful things we did was really think about the cost of that care. So most of the care that you're thinking about is outpatient care. So it's visits with a psychiatrist, a psychologist. And we had co-pays on there, and our networks were very, very strict. And so many of the doctors, 30% of the doctors that our folks would see would be out of network, creating issues with balance billing, having to pay the rest of the bill that the doctor has said they're not covered by those network contracts.
Mm-hmm.
So we actually rolled out a program where we would pay for whatever doctor you see in the mental health space. So whether it's a psychiatrist, a psychologist, a child pediatric psychiatrist, and whether they're in or out of network, those office visits are covered at 100% of billed charges,
mm-hmm.
With only in-network copays, which are really low, like $20 per visit.
When did Southern Company realize that this is an area where they needed to be proactive in?
Well, it's been a while. Over the last 3 years, we really realized there was an issue with how people were accessing care. It's really been in the last 2 years, though, where we've gotten feedback directly from employees about their stress levels and that lack of access. And so that's really when we doubled down and started thinking about our program and redesigning it.
Right, and approximately how many people access it?
Well, we've got, I think our last quarter of data had about 3,200 people out of our 33,000 that had mental health claims that came through that we know about. Now we know that there are still people, even with improved programs, improved access, that are hesitant to go get care. There's just internal barriers there for folks. So we hope to see that number increase over time.
Okay, Katie Kirkland, thank you. And may I ask, how are you enjoying the conference so far?
The conference has been wonderful, a lot of insightful topics. There was some conversation on social determinants of health, and I think that we're trying to be a citizen where we serve, and it really spoke to me around we can do more to really kind of provide for a model for care for kind of the people in our communities in addition to just our employees.
Terrific. Thanks for your comments.
Thank you.
And I'm Mabel Jong. Thank you. We have our final interview coming up, so stay tuned.